Hi everyone, I'm Dr. Karishma. Today we are going to discuss exactly what is a breast fat transfer. A breast fat transfer is a procedure where we take fat from one area of the body and transfer it into the breast region. So the fat is taken usually from areas like the abdomen, the love handles, the inner or outer thighs, even the inner knees, and sometimes front of the thigh area. Well, in a fat transfer, the fat is taken out manually using 10 or 20 cc syringes. We use cannulas about 2 to 3 millimeters, making very tiny cuts. Once the fat is manually taken out, it is allowed to settle for a few minutes, and sometimes we centrifuge it and we separate the pure fat from the blood components and the plasma. This pure fat contains the stem cells which we need to preserve and which is essential for the survival of fat in the breast. Now this fat is then transferred into 1 to 2 cc smaller syringes and then it is injected into the breast. So in a breast fat transfer, once we inject the fat into the breast, we wait for about 2 to 3 months and see how much of the fat has survived. The stem cells in the fat decide how much of the fat is going to survive. The instrumentation we use for fat grafting and the procedure, the technical details are very crucial to decide the final outcome of the breast fat transfer. So most of the women who come to me looking for a breast fat transfer procedure are those women who are uncomfortable with the size of their breast. They want a mild to moderate volume enlargement, but they do not want silicone implants. The advantage of the fat grafting is that we are using your own body tissue. So the tissue from your own body is just getting transferred from one area into another area. So that's the advantage of the fat transfer. These women, many of them have lost volume sometimes after multiple pregnancies and have specifically lost volume in the upper pole of the breast. And the fat grafting is an excellent technique to give that volume on the upper part of the breast. Usually we do not get a very large augmentation with a fat transfer because every time we transfer the fat, we tend to lose about 30 to 40% of the volume. So these women, I usually advise them that they should repeat the fat transfer about 3 to 6 months later, and maybe they would require about 2 to 3 stages. So any of those women out there who are looking for a breast augmentation but do not want silicone implants, I think the breast fat transfer procedure is an extremely simple technique that you can do. If you want to know more, you must call our clinic, take an appointment and book a consultation. It's always good for us to know what are your requirements and what is it that you really desire and whether the fat transfer is an appropriate procedure for you. In some women who are extremely thin and do not have much fat in the body, this procedure may not be advisable for you. But those women looking just for a minimal augmentation, the fat transfer is a fantastic procedure, and it also has the advantage that it takes off fat from another area of the body, thereby sculpting and making you look slimmer in the other area. If you want to know more, subscribe to our YouTube channel Dr. Karishma Aesthetics and make sure you hit that bell icon in order to get all the latest updates and videos.